Today, our topic is periapical radiolucencies of the jaws. Radiolucency is an area which permits the passage of X-ray with little or no attenuation, and this is usually seen as black or gray or dark on an exposed film. According to Eversole, radiolucencies can be generally classified as periapical radiolucencies, pericoronal, periodontal, widened periodontal ligament space, multilocular radiolucencies, moth-eaten appearance, and multifocal radiolucencies. Today, we'll be dealing with the periapical radiolucencies. First one is the periapical granuloma. A granuloma means a localized mass which consists of chronic granulation tissue, and this will be formed in response to a long-standing infection. So the clinical feature includes the lesion will be associated with deep restorations, extensive caries, or fractures. Usually the tooth is asymptomatic or mild pain will be present, and always the tooth will be non-tender, and on percussion we get a dull note. Coming to the radiographic features, as you can see in the X-ray, the lesion is seen as a well-circumscribed rounded radiolucency and will be less than 1.6 centimeter or less than 16 mm. And it may have a sclerotic border. The treatment for such cases is either the tooth will be considered for root canal treatment or the tooth should be extracted. For this lesion, a differential diagnosis of radicular cyst or root cyst can be given, but the cyst will be always larger in size, that is larger than or greater than 1.6 centimeter. Next lesion is the periapical cyst or the radicular cyst, and it is also known as a root end cyst or apical periodontal cyst, and this is the most common odontogenic cyst. The clinical feature includes this can range from 20 to 60 years. That is an adult life period. And periapical cysts are mostly seen in the maxillary anterior region. And it is associated with deep caries, deep restorations, or a history of trauma. The tooth will be non-vital. And we can see a slow growing expansion of the buccal or palatal cortical plate. On aspiration, the cyst will give a straw-colored cholesterol-filled crystal fluid. The radiographic feature include a well-defined radiolucency with a sclerotic border, and it is larger than 1.6 centimeter in diameter. And if it is less than 1.6 centimeter, it can be considered to be a periapical granuloma. So the differential diagnosis will include periapical granuloma or a periapical scar, which is also smaller in size, and patient will give a history of root canal treatment. And the treatment is the surgical curettage and the surgical removal of the cyst. Next is a periapical scar. Periapical scar means it is also seen at the periapical region, and the patient will give a history of root canal treatment, and it is also usually seen in the maxillary anterior region. Okay, and this is periapical scar it consists of dense collagen fibers instead of a complete mature bone to be formed. The radiographic feature include a well circumscribed radiolucency as seen with the other lesions, but this will be asymptomatic and non-enlarging. And the differential diagnosis includes a periapical cyst or a periapical granuloma, which will have a change in size and also is larger in size. Next lesion, we will be dealing with the periapical abscess. This has acute form and a chronic form. And the acute exacerbation of a chronic periapical abscess is known as a phoenix abscess. The clinical feature include usually the primary lesion will be a periapical granuloma or a periapical cyst, which later turns into a periapical abscess. And the tooth will be extremely painful, and the surface of the skin of the associated tooth will be warm, and the tooth will be non-vital. And for the radiographic feature, in acute cases, this will be seen, periapical abscess will be seen as the widening of the periodontal ligament space. But in chronic cases, an ill-defined radiolucent area will be seen, also with the loss of lamina dura at the apex of the tooth. Treatment is the drainage of the abscess and also antibiotic coverage. The tooth should be either extracted or should be undergoing a root canal treatment. And the differential diagnosis for periapical abscess is a periodontal abscess, which can be differentiated from other features like crustal bond loss and intra-bony pocket. Next lesion is osteomyelitis of the jaw. In case of osteomyelitis, the main complaint will be pain and a draining sinus will be present. Also, other features like regional lymphadenopathy, fever, leukocytosis, and increased erythrocyte sedimentation rate will be present. It has got acute and chronic forms. In the acute form, there is severe pain, trismus, increased temperature, increased ESR, pus discharge. For osteomyelitis, there will be acute and chronic forms. The chronic form can be again divided into separative and sclerotic types. Sclerosing form of osteomyelitis is again divided into focal and diffuse. That is focal sclerosing osteomyelitis and diffuse sclerosing osteomyelitis. And another form is proliferative periostitis, also known as Gary's osteomyelitis. The radiographic feature includes an ill-defined area of radiolucency, giving a moth-eaten appearance. The trabeculae will be indistinct, and also patchy areas of sclerosis can be seen. And the border between the sclerosis and the normal bone will not be clearly visible. And frequently there is sequestrum formation within the ill-defined radiolucency. Treatment is debridement and drainage, and also tooth should be either gone for endodontic treatment, or if it cannot be said, should be extracted. The differential diagnosis includes chronic alveolar abscess, Paget's disease. In case of Paget's disease, several bones will be affected. Next periapical lesion is early stage of periapical cemento-osseous dysplasia. And this is the most common form of fibro-osseous lesion. And this lesion has, that is periapical cemento-osseous dysplasia, has three forms: that an early osteolytic form, an intermediate mixed radiolucent radio-opaque stage, and a mature radio-opaque stage. And for the early stage, the clinical feature will be more than 30 years, and it is usually seen in females, black females, and also in the mandibular anterior region. And for the differentiating feature, the tooth will be always vital. The radiographic feature is a uniformly dense radiolucent area will be seen, and in the later stages, it may contain a well-defined border. Differential diagnosis is traumatic bone cyst. In this case also, the tooth will be vital, but the lesion will be very large in size. Our next lesion is the traumatic bone cyst, and it has got a lot of synonyms. And the most common includes extravasation cyst, solitary bone cyst, and unicameral bone cyst. It is considered to be a false cyst because there is no epithelial lining. Instead of the epithelial lining, a connective tissue capsule will be present. For the clinical feature, patient will be giving a history of trauma, and it is usually seen in young adult males. And the most common site is the molar region, followed by the premolar and then the incisor region. On aspiration, it's just a fluid-filled cavity. That is an empty cavity. The tooth will be always vital, asymptomatic, and this lesion is usually diagnosed during a routine radiographic procedure. The radiographic feature include a smoothly or a well-defined radiolucent area. Sometimes it may contain a sclerotic border. And the differentiating feature is that it has got a scalloped appearance. That is, the lesion is seen extending between the roots of the tooth. In case of posterior teeth, in between the roots of premolar and molar region. And these lesions are seen above the inferior alveolar canal. And the size will be larger than 1 centimeter. Treatment is re-establishment of bleeding by surgical intervention. And the differential diagnosis is periapical cementosis dysplasia, which is seen in the anterior teeth, staphylosis, which is seen below the inferior alveolar canal. This is a growth idea about the periapical radiolucencies. Lesions include periapical granuloma with the differentiating feature, diagnostic feature of well-defined radiolucency, which is less than 1.6 centimeter or 16 mm. Radicular cyst, in that case, the tooth will be non-vital, slowly enlarging, and the aspiration fluid is straw colored. And the size is greater than 1.6 centimeter. Periapical scar, usually it is seen in RC treated tooth. Periapical abscess, the usual site being a non-vital tooth, and the aspiration gives a yellow colored fluid with a widening of periodontal ligament space. Osteomyelitis, which is usually seen in adult males, and the radiographic feature shows sequestrum within the radiolucency. Periapical cementosis dysplasia or cementoma, that is, in that case, the tooth is vital, and radiographic feature, a well-defined radiolucency is seen below the vital tooth. In traumatic bone cyst, it is usually seen in the mandible, and the tooth will be vital, and the patient will be giving a history of trauma. And also scalloping between the roots will be seen. And to conclude with, while examining a patient or examining a case, a step-by-step evaluation should be done. And also a knowledge about most of the pathologic condition and the anatomic variation is required. So proper diagnosis will help in proper treatment planning and also management of the lesion. Thank you.